My name is Rachel Amps. So my surgery was February 10th, and today is March 15th. So technically I am 30 days post-surgery. With the cute little 2 days shorter in February, it's a little messed up. But yeah, technically I'm 30 days post-surgery. My surgery went well. It, if I'm being completely honest, was a complete haze. Can't remember too much from checking in. I checked in, went to the surgery prep area where they have you get in the cute little gowns and stick you with needles and get you ready for surgery. And last thing I can really remember is being rolled down the hallway and into the operating room. And the last thing I said was my name and my date of birth, and somebody in the surgical room had my exact same birthday down to the year. And the last thing I said was birthday twins, and then I black out. I can't tell you what I said after that. Waking up from surgery was interesting. My brain is pretty blurry at that point, so I can't really remember what all I saw. I know there was a nurse nearby, and I remember the sensation of them taking the oxygen tube off my nose, and I had no filter, so I had said some really stupid dad jokes. One of them being when they went to take off the leads. So you have one on each side of your chest and one on the side. When she went to take the leads off, she said that it might pull some of the hairs off my body, and I stupidly said, "Free body wax." And then they determined, because I guess I was making dumb dad jokes, that I was ready for a room. So they moved me from the post-op area to a room. And I feel so bad for the person who was moving my bed, because they warned me that the bed was going to drift a little bit. And I said, hell yeah, Tokyo drifting. So I would say surgery was great. I was so high, I had no filter. The first thing I can actually kind of remember saying with a clear head after that was, they asked me how my pain was, and I said it felt like I had been socked really hard in the chest or hit by a truck in the chest. But pain was not what I expected. It was more just soreness, bruising sensation. I expected like a burning, stinging cut sensation, and I never got any of that. So surgery was great. Look, I would assume that between my stupid dad jokes and some of the violent patients they get, they really appreciated me. Yeah, they warned, so here's a cute little side note. I noticed that the nursing staff had their stethoscopes in holsters on the side of their hips. And in fact, the pre-op nurse was talking about hers. Like, she's like, I just got mine. And so I asked a different nurse who came to put my IV in, why do you guys have the holsters? And he told me that when they get the more aggressive patients, if you have it around your neck, the patient can grab it and pull you towards them and then headbutt you really hard. And he had been headbutt several times and determined that the holster was a better alternative. Was there anything during the recovery process that surprised me or was difficult? Yes and no. I was advised prior to surgery what I was going to go through. Like, I was going to have drains. She advised the type of surgery she advised on different types of surgery, and I went with one where I was going to have just 2 flat incisions. So I have no more nipples. All that's gone. So now I just have 2 scars across my chest. I was surprised with how uncomfortable the drains were. They did advise me I was going to have a drain on each side to help with fluid and make sure no fluid collected under my chest, because then you get the best way to describe it is like a waterbed chest where you can see ripples. And I did have a very small little fluid collection that occurred after the drain was removed, but it has resolved itself. But yeah, I was very surprised at how uncomfortable the drains were. The drains kept me from being able to correct my posture. I found most of the time I was kind of more hunched forward because I didn't like stretching out. I felt like when I was stretched out, the drains were just somehow digging deeper. I don't know if that makes sense. I was also surprised during recovery that I had no emotional breakdowns over the loss of tissue. I, to this day, still have not had any sense of like, I don't feel like me, or I don't feel feminine because they're gone. Like, I'm fine with all that. I did, however, end up crying because I was getting so frustrated with the drains and wanting to take them out. And they told me that, you know, you have to wait till your appointment. And yeah, I ended up crying because I was so upset with how they felt and the pain they were causing. Another thing that's kind of shocked me during the recovery process is phantom sensations I have had. So in the first 12 days, I would say, I had some very bizarre phantom sensations of my nipple being either pierced or stabbed. And I understand it was my brain trying to find the missing material. So what I would do to counteract that was to physically grab onto my chest and look down and tell myself, you do not have nipples? Stop. There's no reason for these sensations. So that was kind of, I feel like it was sort of expected, but not to that extreme. I thought maybe I would have different sensations of still having the entire breast. But I've only gotten weird phantom nipple sensations. So that's neat. Another unexpected part of the recovery has been what I would describe as sticking a fork in an outlet or touching an electric fence. Like, not a cute little static electricity shock, but like a big shock. And it happens randomly, and it's usually one side or the other or all the way across my chest, and it usually causes me to do something like that. Like, I end up just like kind of locking up because it's such a bizarre sensation. And in talking to other people who have had similar surgeries or amputations, they too get these bizarre shocks. And I understand it's just my brain is trying to find missing nerves, and these nerves are trying to reconnect. So there's unexpected and unintended consequences. What was I thinking and or feeling the first time I saw myself after surgery? There were a couple different, I would say, first times. Admittedly, the very first time I got a peek at my chest, I was still in my anesthesia haze because I was in the hospital, but basically the nurses came in and I had ACE wrapping on. So they wrapped me with ACE wrapping and then a bunch of cotton fluff. It's not exactly cotton balls, it's not exactly cotton gauze, it's just like this really fluffy, cottony stuff that they pack in there. And then I had what's called steri strips. So instead of getting stitches, it's like this really cool medical tape that like really holds everything together and keeps it clean. So the first time I got a peek, the nurses had come in to do what's called wound care checks. So they literally just kind of pulled some of that away, and I couldn't help myself. I took a peek down, and admittedly, I was so foggy-headed that I don't think it really registered what I was looking at. I mostly could just see the ACE wrap in the cotton gauze, and I was like, wow. So, that I don't think it really registered then. I mean, I knew something had to be gone because of the pain. I was like, obviously stuff's gone. I did not have hot dog chest like my terrible nightmare. The next time I really kind of took a look at myself after that was at home. I had taken my button-up shirt off and was just kind of looking at the wrapping, trying to understand what it was, what was going on with it. And I was just like, so I was kind of touching it and just reminding myself, everything's gone. And I was also just kind of touching it to get an idea of like how much did it really hurt. And through the medication, it really didn't hurt much at all. It just felt sore and bruised. Like that was just kind of the consistent feeling. I would say it was probably about 24 to 48 hours after I got home. I finally took the ACE wrap and everything off because they did tell me you're going to have to do a gauze change just to make sure nothing's leaking. And so I recorded a video of myself on my phone unwrapping everything and taking the cotton off. And the first time I saw myself, I think I was pleasantly surprised is the best way I can word that. I knew I was swollen. So everything looked very puffed up. So that was something I kind of immediately told myself was, this is temporary, this is swelling. So the puffing and the dipping that you're seeing is going to change. Because my biggest concern was I felt like I looked concave, but that was because my sternum was very swollen. The immediate area all around where the tissue was also very swollen. And so I think I had some mild concern, but I wasn't scared, I wasn't shocked, and I wasn't horrified at what I had done. I was just kind of like, okay, this is what it looks like. And I get for some people, they probably don't have that reaction. They probably do immediately break down and cry. But I think because I went into this with tons of support and tons of knowledge and mentally prepping for about 5 months, I didn't have that overwhelming reaction. So I would say I'm very lucky in that sense, because I know some people, they get a cancer diagnosis and it's like straight to surgery within like a couple weeks. Surgery is, I would say, changed over the last however many years, where unless the patient requests it, full or partial mastectomies are usually no longer the norm. They'll usually do like a lumpectomy, where best way to describe it is they go in and kind of melon ball scoop the tumor and some tissue around it and take that out. So mastectomies have kind of switched to preventative medicine, in that if you do genetic testing and you have the knowledge to know what your options are, I mean, you don't have to do a mastectomy. It is still 100% a choice. And in fact, even during surgical check-in, they still double check that I wanted this surgery and this is, something I wanted to sign off on, so that way legally I can't go back and be like, I never wanted this. I actually did want it. I think within my generation, the millennials, and even maybe some Gen Xers and Gen Z, I think the mindset is changing, that you do not have to have breast tissue to be feminine. The way I've posed it in my mind is, it is just fucking tissue. Do I keep the tissue, or do I keep my life and hopefully keep a longer, healthier life? In my mind, the decision was pretty clear. And there's all kinds of reconstructive options out there. I chose not to do reconstruction just because one option isn't open to me. I do not have enough body mass for them to use tissue from my lower abdomen. So I can't do that option. And then the idea of an implant, it just sounded so uncomfortable. Because that would mean I would have at least 1 to 2 more surgeries in my lifetime, assuming nothing else goes wrong. Because they did sort of list out the things that can kind of go wrong as you and the implant age, and I just wasn't sold. So myself and other females who post openly on the internet and who don't post at all have decided that the flat life is fine. I have some wonderful friends in drag that if I truly miss it, they have told me where to get these silicone replicas. So I could have a lot of fun with that. It could be an A cup one day, double D the next day, and no one can say shit. Admittedly, there are some parts that I'm still trying to, I guess digest is the best word. So what's pretty interesting is there are some clear-cut lines between where breast tissue and muscle used to connect and sort of exist. I'm struggling right now to digest these weird dips. So kind of right about this area, I have muscle right here. And I did start building muscle before surgery to try to help cope afterwards. So I have this funny little dip that starts right about here. So I have this little poof, and then I have this severe dip. And, trying to adapt to this change in landscape in this dip right here, I catch myself staring at it a lot, and I keep trying to remind myself that these things can change. Even though I'm 30 days out, I'm not comfortable trying to lift too much weight yet. My nerves are still just kind of all over the place. My muscles feel tight. So I find I can't, it's funny, I can reach really far backwards, But forwards, because the muscles pull differently, I can't reach as high up as I used to right now. Even doing stuff like this, it starts to get really tight in my armpits. So yeah, I'm trying to remind myself that as the tightness goes away, I can work out, I can sort of help everything regrow and reshape. I also have kind of funny little, it like points out. So where my sternum is, there's these 2 points, which are the very end of my scars, and they poke up just the slightest amount. So it looks like little points up. So those are the things that 30 days out I'm trying to still get comfortable with. But overall, I'm still pretty happy with how everything looks. The skin does not look like it's stretched or sagging or loose. So overall, my surgical experience and recovery experience as a whole is considered common. Now this will vary person to person. Some people may find their nerves are firing off a lot more. Maybe they're firing off different sensations. But my doctor did tell me that a lot of patients end up kind of in the same category as me, where the pain they feel is not the pain they expected. And that's usually a good thing. Most people end up with just the sore, bruise sensation. In very rare cases, they'll get the burning, stinging, but they also have to keep an eye on if you have burning, stinging, because it can be an indicator of infection. Very rarely will a patient have complications where they end up with infections or too much bleeding and having to be taken back in for emergency surgery to correct the bleeding. And that is why I had to stay overnight in the hospital. They just had to monitor me for bleeding, any signs of clotting or strokes or things like that. They did their job. They did it well. And I am probably considered in the bulk majority a normal case. Anybody who's watching this and considering this surgery, or perhaps has done this surgery, you may have different outcomes. You may have complications. You may have too much bleeding and have to be taken back in. You may end up with an infection later. If you don't follow your doctor's orders, which I have had family members who don't, you can sort of mess up your own recovery. They warn you not to reach very high over your head, so I could brush my own hair and wash my own hair, but they didn't want me reaching up like this. They didn't want me picking up lots of weight because you can damage the surgical site. It can rip back open. The skin can actually pull away from the muscles, and then you end up with what I would describe as slip and slide chest, where your skin just kind of freely moves. So that was something they warned me before surgery. Don't do these things, because if you do, here's the potential outcomes. So just make sure you listen to your doctors within reason. If you feel okay doing something, do it, but make sure it's not against their wishes. And 2 weeks later when you're done, and if you feel comfortable picking up 100 pounds of weight, then go for it, I guess. But just make sure you're careful and listen to your body. So when I first woke up after surgery, and even in the days and weeks that have followed, I have felt a sense of relief. I feel like the invisible timer that I sort of described prior is no longer above me. Both are technically gone at this point because I did the surgery. But I feel like the invisible cancer timer is gone. Now, I'm not at a 0% risk. I have a 2% risk because they cannot scrape every single breast tissue cell out of me. But it would be a lot faster to detect it at this point and a lot easier to treat it. So yes, I feel like it's worth it. So there are some people, they're faced with the same decision as me. They have a risk. I don't know statistically what their risk is. I know what mine was. And so it's up to them. They don't have to choose the path I chose. They probably have been advised by their doctors, yes, you can do every 6 months you do an MRI, and then every other 6 months you do a mammogram. And I got burnt out on that path so fast. I didn't want to do it anymore. So I think, if you're stuck on the fence, there's some things you should consider. Statistically, what is your risk? And look at your family history too. How many people in your family have gotten cancer? Does it seem to add up more than just the on paper statistical risk? because they have talked about these genes they're still studying. So the numbers may change over the years as they get more data from people like myself. Another thing to consider is, what is your time worth? You know, for me, this was technically a 2-week recovery, but I took a full month off because I have the support and the resources to do so. So 1 month of my time to do a preventative double mastectomy versus, I would say on average, 6 months, 12 months, 18 months, years of your life to fight cancer, assuming you win. Because there are some cases where, unfortunately, you won't. So that's something else to consider if you're on the fence. What is your life and your time worth? You know, this was 1 month for me. I'm back to work. I'm slowly getting back into normal life. I feel like it was worth it. Okay, what were the resources I used to learn more about my genetic mutation? So obviously I had my medical staff. They were great, and every step of the way they told me this is your own choice. Outside of my medical staff, so I did not turn to Facebook experts, but I did look at my own familial history. We have had quite a lot of cancer on my mom's side, which is where this gene came from. Several of the females have either had cancer multiple times or have unfortunately passed away from it. And during my time away and between the first session and today, we lost one of my aunts to breast cancer. I don't know if she did genetic testing, but I would have to assume it's the same gene. Outside of familiar resources, I did look at some social media influencers, and I have not found anybody with the same gene as me, but I did find several women with BRCA mutation. They did the preventative mastectomy, and they also still feel very feminine even without the breast tissue. They have adapted well. Some of them have done tattooing over it. Others have left it completely alone. And they, you know, same thing. They had the same internal conversation of, what is my life worth? What is my time worth? Do I keep the tissue and keep my risk? Because BRCA is like a 80 to 90% risk. It's very high. Or do you get rid of the tissue and hopefully have a nice, long, healthy life? So having all of those resources, all the time to think on it, and really understand that culture is shifting and that the way our bodies look does not define our gender, was really helpful. Now, don't get me wrong, this new administration is kind of scaring the shit out of me. I have had a few moments of panic, wondering, will I be labeled something that I'm not? Will I be accused of something I'm not? And they can go through my medical files for all I fucking care and realize why I did this. I have a gene mutation. I did this because I value my life over tissue. If it bothers them, they can shove a stick up their ass. So right now I have some scar care salve that I got from Casita Herbals in town that I'm using to ideally lessen the appearance of the scars. I mean, right now they are very bright pink because they're so fresh, and the purpose of the salve is to heal them even more so they kind of go back to skin tone and look very unnoticeable. I couldn't 100% say right now yes or no to a chest tattoo. My nerves are so unsettled that the idea of being tattooed in that area sounds completely unbearable. But I understand with time the nerve sensations go away, they calm down. So maybe in a couple years I might consider it. I've already had a bunch of people asking, are you going to get tattooed? And I'm like, I don't know. Like right now it's too much to consider. I also am aware there is a clinic, I want to say in California, I could be wrong, but there is a specialty tattoo clinic that specializes in tattooing nipples to a hyper realistic phase, like to the point where they look so real, they match like skin tone perfectly and all this. That's probably not something I'll ever consider. Again, I don't feel like I need the tissue and the nipples to feel feminine or even human. I might just enjoy the scars for a while and then go from there. But maybe if I see like a really cool badass chest piece, I'll be like, fuck it, numb me, let's go. But definitely not right now. No. I can't not say it, so I'm going to just have to get it out of the way. I'm sorry in advance for this. We're just going to blame it on the fact that I lost my filter, apparently, during surgery. Dear past self, you have smoking hot tits now. Literally. I cremated them, and I have the ashes and the certificate and the cremation tag to prove it.
On that note, can we see them? Can you just...
You want to see my tits?
Yeah.
Yes. We've been making these jokes that I could, like, walk into a bar right now and be like, you guys want to see my tits? And people be like, and then just, like, whip out. Right here. Anyway, here are my boobs. This is literally the bag I was given by the crematorium. It was quite the experience to have a gal walk out and give me a adorable gift bag with my boobs inside. In the bag were 2 baggies. One of the baggies held this, which is the cremation tag. This literally goes in the fire with ideally a full human body, but body parts. And in here is what's left of my smoking hot tits. Ta-da! Here they are, my smoking hot boobs. All the jokes I'm gonna make. Also, I've had people like check this out and like the looks on their face is great because either they start laughing or they just go, oh, and I'm like, dude, it's fine. Also, I've been looking for what was a titanium marker in here and I haven't found it yet. Sorry for the glare. You're gonna have to tell me how to not.
That's perfect right there.
Yeah? Yeah. And this is the official cremation certificate certifying that my breast tissue did indeed get cremated and apparently passed away. Which is, I feel bad for the crematorium. Obviously, they don't do this a lot. So they don't just have, like, was separated on or anything like that. But yes, I have an official cremation tag and certificate as required by funeral home law. You have to provide these things when anything is cremated, including just tissue. I just feel bad for the medical staff that I, like, couldn't stop myself. You know what really sucked about the dad jokes I was making in the hospital was I could hear myself saying them. And part of me was cringing on the inside, and I was like, I can't stop myself. Like, there was an internal me, like, you know, you got the little voices, and it's like, stop, why are you doing this? And then yet, like, real me was just spitting this shit out. Just free body wax, Tokyo Drift. Like, someone stop me. It was great. 100% less dad jokes. I would say it was worth it. That even though I was definitely terrified and that I definitely did not sleep well the night before surgery, it was worth it. This is going to be worth it in the long run. You no longer have to do mammograms or MRIs. Your cancer risk is down to 2% because of all the choices you made. The complete pathology workup that they did after surgery proved that there was no cancer. So I feel like I did the right thing, and I feel like I've hopefully made the right choices to extend my life. You know, I could walk outside today and get hit by a bus. But, you know, my cancer risk is down to 2%, so whatever. But yeah, I think it was worth it. Everything that I felt emotionally was valid. I mean, emotions and feelings are always valid. So yeah, I mean, I get why I was scared, never having had a surgery before, and it being a very big invasive one. But it was good. You had a good medical team. They took good care of you. You made horrible dad jokes while you were high out of your mind. I think the staff was okay with it because nobody told you to shut up or gave you a shot to knock you out. So I think we're good. Yeah, you made good choices. Keep making good choices. It was worth it.